Are you coughing during your pregnancy and absolutely miserable and also sort of worried if it's going to hurt the baby or if it could break your water or start labor? Today we're going to talk about all of those different things. And I just want to say I'm here with you. Your baby is already creeping up into your lung space. So when you add an upper respiratory infection or extra coughing or even like a bronchitis, it's so miserable. I hope this video can help you out. Also, when we're talking about coughing during pregnancy, it can actually be really serious. So it's important that you take your advice from an expert. And of course, you're gonna wanna let your provider know if you are experiencing an infection during your pregnancy. However, as a nurse who dealt with thousands of people who had a cough during pregnancy, I'm here to sort of give you the basics in the meantime before you can get in touch with your provider. Okay, first off, this is a question I get a lot. Can my coughing hurt the baby? You're coughing and it feels really hard. It might even make you pee, so can it hurt the baby? So you gotta remember that baby is inside the uterus, which early in pregnancy is pretty darn thick. Then on top of that, there's layers of adipose tissue, aka fat, muscle, and here you got a big fat diaphragm. And so ultimately your fears about hurting the baby are generally unfounded. Although if you're in your third trimester, make sure that you're doing your kid counts to make sure that baby is doing all right as well. I know a lot of you wonder if it's going to make your water break. There aren't any studies showing coughing made people's water break. And if it can put you into preterm labor. And again, we haven't seen that coughing can put you into preterm labor, although a virus can put you into preterm labor just because your body is experiencing so many things. And I'm here to tell you that, well, we have taken like colds and flus kind of in stride because you're young and you're a vibrant pregnant woman. During pregnancy, they can end up being really serious. This is why they recommend the flu vaccine and COVID vaccine during pregnancy. Again, talk with your provider to see if they're right for you, but I am here to testify as a nurse who's seen real bad problems due to the flu and COVID. You're gonna really try and avoid these illnesses if you can. This video is sponsored by the online prenatal class for couples. If you are looking for an easy way for you and your partner to get prepared for your upcoming birth, go ahead and join me inside. I'm gonna put the link down below. Okay, let's talk a little bit if you have lung involvement with a cold, flu, bronchitis during pregnancy and the things you should be watching for and knowing. First off, as I said before, your baby moves up into your lung space, so you ultimately have less space to breathe in than you did pre-pregnancy. Now, your ribs expand a little bit to compensate for this, but it's really important that you are getting oxygenated during pregnancy. If you're having tons of coughing and you have access to an oxygen saturation monitor, I don't think it's a bad idea to just keep an eye on your oxygen saturation because we want to make sure that you and baby are both getting the oxygen that you need. And of course, with that, baby needs extra oxygen. So it's not just the oxygen you need to survive, you're actually supplying oxygen for another person as well. Guys, I feel like we have to do everything during pregnancy, right? Even when we're sick. Now, during cold, flu, bronchitis, pneumonia, all those different things, you have an increase in fluid needs. And when you are pregnant, this little thing takes all of your fluid. Personally, I had a pretty bad, I would say it's probably a flu. When I was pregnant with my second baby, I thought I was drinking a lot. But I was miserable. I had another kid at home. I was, feeling bad for not going into work because I'm a nurse. And I was not drinking as much as I needed to. I went to go see my doctor for just like a regularly scheduled prenatal appointment. I could barely walk into her office and she was like, "Hillary, what the heck is wrong?" And because she was an amazing doctor, she actually gave me 2 liters of fluids in her office until I could show that I was no longer passing ketones in my urine, which is ultimately how they were showing if I was dehydrated or not. This little baby will take all the fluids it needs from you and it will leave you absolutely miserable. And I've got to tell you, after I got those 2 liters of fluid, I felt like an absolutely new person. So if you are not feeling well, make sure that you're hydrating yourself. Ask your friends and family, anyone that's around, make sure that you are hydrating. This is a time where you're just trying to get in whatever fluids it worked. I was trying to drink like a peppermint or a honey lemon tea, but at this point you need to get in whatever fluids you can. So make sure that you're drinking regular water and then supplement with something else that might help with the cough. Now, I know a lot of you guys came to this video hoping I could tell you what kind of medications you can take with a cough. I do have a post about what you can take that's over the counter during pregnancy, and I link to things because it's really important that you take the specific kind because a lot of these cough, cold, flu medications have a bunch of different medications combined. So you want to make sure that you're taking one that just has one. That's why I link it down below. But ultimately, you got to talk with your provider because, again, with these medications, some can be really problematic if you have high blood pressure, or other issues like asthma or any medication allergies that you have. So I can't tell you exactly what medications you could take, but you can check out that link below to see if that can help you out. But I am also here to say, in this situation, your best friend is fluids. Lots and lots of fluids. Like I said before, I felt like a whole new person after 2 liters of fluid, and I had to get it in an IV, but I easily could have drank 2 liters of fluids on my own at home if I had just been smarter. So please don't be as dumb as Hillary. Make sure that you're drinking a ton of fluids. If you are awake, make sure you have something by you that you can drink from. And pro tip, if you have other little ones at home like I did, do not be sharing straws with them. Make sure that they are having their own cup while you have your own cup as well. A few homeopathic things that can help. Like I said, a honey lemon tea can help, although some people absolutely can't stand the taste of it, including my daughter. So just see if it works for you. Again, fluids is more important than that tea, but a lot of times honey and lemon have been shown to decrease coughing. Another thing I do, which I have no idea if it works, this is totally just like Hillary throwing something out there, and it sometimes works with my kids, is to put menthol on my feet. That's right, not on my chest, on my feet. And then you put some socks over it, usually old socks because it's kind of gross. But I don't know why. Sometimes it helps. It literally makes no sense. But sometimes during pregnancy, just doing the placebo thing that is safe for both you and baby might have some effect for you. By the way, does anybody have any other weird things that they've tried for their coughs? Tell us down in the comments. One other thing, if your illness includes a sore throat, another thing you can do is to gargle with salt water. The salt water should be like the sea, very salty. This isn't just a sprinkle, very salty, and then you'll gargle with it because it really helps those inflamed tissues as well. And again, ask your provider if there's anything else you can take. If you have a serious enough cold flu that you aren't going into work, I would definitely recommend calling your provider just so they know, because it really can turn into something serious and it's something you're going to want to watch. One of the big things I totally recommend watching for is shortness of breath. If you suddenly have a lot of shortness of breath, that's something that should send you into labor and delivery. It could be something really serious and we want to make sure that you get checked out. Now, there is something that you can do that can check on your health and baby's health. I'm going to put a link to it right here, but it's so important. I want to make sure that you're making it a priority.